Hi, I'm Roxanne Coria, and you're watching Ask the Expert. As the seasons start to change and the days get shorter with less sunlight, some people may start experiencing changes in their mood and behavior. In this month's episode of Ask the Expert, we're going to talk about seasonal affective disorder. An often misconception that we have about seasonal affective disorder is, it's thrown out kind of loosely. A lot of times when it starts to get to be the winter or fall, we're all a little sad. We definitely miss our summers, especially if you live out in Indiana. But seasonal affective disorder, it's really important that we understand that this is linked to a more serious diagnosis, such as major depressive disorder or bipolar. So it's not just diagnosed by itself. So it wouldn't be that we just feel a little bit sad when the weather starts to get a little bit colder. Sometimes we experience sadness over the course of holidays when we experience the loss of someone, and again, seasonal affective disorder is not correlated to that. So some symptoms to look for to see if maybe you're getting some of the symptoms of seasonal affective disorder would be loss of interest or pleasure in doing things that you may have normally had interest in, some increased fatigue over the course of the day, or even just depressed mood that's lasting most of the day. Some of the ways that we can reduce the symptoms of seasonal affective disorder would be going out for walks, trying to make the most of the sunlight that we do have during the colder months. So if it's a sunny day, trying to go outside and find activities that we can do. So some of the treatment options, first and foremost, of course, psychotherapy, like we talked about, available at NorthShore, but there's also light therapy. There are these really cool lamps that you can purchase. They even have them on Amazon that actually give off sunlight. So those are very helpful. It's important to have your vitamin levels checked. A lot of times during the months that we have less sunlight, some people are experiencing like a vitamin D deficiency. And then overall, just utilizing those positive coping skills like journal writing. Mindfulness is a great one. Tapping into all of your senses, maybe going for a walk and like just noticing how the breeze is feeling, how the sun is feeling, hearing all the things that you're hearing outside, like the birds chirping and the smells that go into that in fall and winter. So any kind of positive coping skills like that would be helpful. NorthShore Health Centers has several locations that offer behavioral health services. Schedule an appointment with one of our mental health therapists today. For more information, visit northshorehealth.org.